Okay, just practicing a newborn assessment. Um, I'm going to, here's the baby. I'm going to start off by just doing a general survey. I'm going to look at the baby and I'm going to look at the just overall presentation. Is there anything that stands out that's abnormal? I'm going to look at the skin color. I'm going to look at the tone. Most babies are flexed. All right, their limbs are bent. They're flexed, so that means they would have good tone. Sometimes they have vernix caseosa, that white cheesy stuff increases. That would be okay. Small little hairs, um, laningo, fine hairs. It was for helping the baby to stay warm. Some of that, sometimes it's around the ears and everything. The newborn rash, which is normal, erythema toxicum, looks kind of like acne. These are normal things, and I'm just kind of doing a general survey. There are very common, um, there are common skin conditions that are kind of hard to show right now, but like the stork bites or the melanocytosis, we used to say Mongolian spots. Those are on darker skinned babies. A dark, almost looks like a bruise, and that's why it's it's very important to document those spots because it can be confused with bruises, um, but it blanches. So if someone has a melanocytosis or Mongolian spot, you would press it and it should blanch. Bruises don't blanch. So that's one thing that's different. The strawberry hemangioma, raised red purple areas, mottling, all right, blotchy, patchy appearance of the skin while the circulation is kind of adjusting. There is, so there are different things that you would want to be familiar with. Now, generally, what I do when I do an exam is I have the baby with no clothes on, and the baby would be on a heating pad to stay warm. There are some other sources that say that you could do body part and keep what you're not, the part that you're not doing, you could just have the baby covered. So, you can decide or do it based on how your preceptor wants you to do it. But for our purposes here, I'm just going to have the baby with no clothes on. I might just go ahead and fold this so the baby's on that. So, what I generally like to do, what I find is a little challenging, is the measurements. And I like to do the measurements and the weight first. The family is concerned about the weight because they, usually how long and how much does the baby weigh. The other numbers may not mean as much. Now, if the baby is quiet, I'll go ahead and do vital signs. So I would, listen to the heart rate. They say to listen to 1 minute completely. And then when I listen for lung sounds, I'll come on the side a little bit, just to make sure I can hear it. And I would do that. And then I would take the temperature. I could put a thermometer under the arm and hold it. Or I could do the forehead thermometer, which they say isn't as accurate. Um, so you can decide how you want to take the temperature. But I would do vital signs if the baby's quiet. Um, I'm not sure why, but some people, practitioners, will use the diaphragm portion or the bell, I should say, for checking for heart murmurs. So you want to listen to breath sounds and the rate and rhythm of the heart. So if I'm listening to breath sounds, I would go from side to side. Heart sounds, I'm going to go over here at the apex, and I'm going to listen for the minute. Um, Murmurs, or any adventitious sounds, I might use the bell. I'm not sure the rationale of why I would use one side or the other, but that could be Googled. And then when I turn the baby over, I would do the other side. And then you can go ahead and weigh the baby at this time. Um, I find that that's exciting for the family. They have digital ones, and those are good if you can't see well. Um, it might be a little bit easier if there's dim lights. The family wants the dim lights. I usually like the lights bright. I'm an older practitioner, student practitioner, student midwife, so I like it light. And if I'm going to give them a good assessment regarding the baby, I want it light. So we're going to go ahead and do the head circumference. All right, so we know that normal is 12.5 to 14 inches. So we want to make sure I do inches. You can look at what that converts to. And we're going to come around and right above the eyebrows. And this baby is 12 and a half. And then we do shoulders. So we'll do the shoulders, and that's 15. And then we'll do the chest. And I just find that if you can get help just to stabilize the baby, and a doll is so easy. So that's 13, or let's say it's 12 and a half. Ideally, it's 1 inch below the size of the head circumference, but it's not always that. And a doll certainly isn't going to, reflect that. And then we'll do the abdomen. Um, Abdomens are normally distended on babies 14. And then we'll do the length, which I personally find is the hardest part. So I'm going to Google some videos and see, but I'm going to put right there, and then I'm going to come down. And then I usually ask someone to hold it, okay? And then I'll just extend the leg. And I usually relax. I don't pull it hard. I don't pull the leg hard. I wait and relax. And then it's usually between, 18 and 22 inches, okay? And then I document that. And so we're looking for abnormalities all along, and they would, some of them are very obvious. And then we're going to go ahead and start our assessment. So let me just go back to vital signs. A temperature would be 37, normal would be 37.7 to 99.5 Fahrenheit. You want to keep your baby warm, and you want to get proficient and quick at this so that the baby doesn't get cold. All right, so like I said, I put a heating pad, it's on low, and the babies usually are really comfortable and they like that. Other than that, you can keep them covered and do, different sections, covering sections that are not used. Respirations are 30 to 60 beats per minute. They have times where it's, irregular, and periods of apnea, I guess, if that's the right word, where they stop breathing for a little bit and then they start again. So, but they shouldn't be having retractions, difficulty grunting. That wouldn't be normal. And then your pulse rate, your heart rate is from 110 to 160. Some resources or will say one between 120 and 160.